You designed your solution to help, but providers aren't actively using it because patients keep forgetting to engage with it. The problem might not be your product. It's how you map the client journey once the solution have left your hand. Here's what we learned from a health tech leader who got it right. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Hi, this is Sabrina Runbeck, your host, back to another exciting episode at Vive. And as every year we come to healthcare conferences and getting to know other solutions, getting to know you guys, what you guys wanted to actually adapt either into your health system, you as providers, clinicians, and then sometimes us as patients ourselves. And despite how much, letters behind our name, when you get help, when you are your own patient, how do we figure everything out? So today we have an exciting conversation with Luke, and it's all about leveraging the innovation side of healthcare and doesn't feel like it's burden. It's really supporting from a multifaceted way. So Luke, tell us a little bit about your journey. How did you get to this point? I think everyone have started their journey with a problem, right? Where's the gap? Then what was that?
Well, for me, so I am not the founder of Brook, but the way that I found Brook, or I first came across the problem, was looking after my dad who had leukemia in Australia, and I saw him through that entire battle until we lost him. And I remember at the time, I wasn't in healthcare, but I remember at the time thinking, geez, there's just so much that's backwards about the way that we're dealing with the way that healthcare is dealing with the communication with my dad through that, and me as his son and my sister that's taking care of him. There's got to be a better way that we can leverage tech to do this. And I was in technology at the time. And fast forward a couple of years later, the opportunity came up to do some work with Brook. I looked at it and I was like, oh my goodness, this is exactly the sort of product that I was looking for when I was facing these challenges myself with my father. That was my story. But I think if you're, talking to Oren or Kit, they just realized the same sort of thing, that there was just so many better ways to leverage technology throughout the patient journey to help them be compliant, to take care of themselves, and also to take weight off providers and systems in doing so. They might get 15 minutes with a provider, but there's all this time they've got at home where they can leverage a company like Brook or technology like Brook to help them stay healthy.
Yeah, we know healthcare has been a little bit of too problem focused, right? You have a disease, once it's diagnosed, then doing something about it. And that journey is, we only have so much time at the doctor's office, in the hospital before you get discharged. The majority of care is at home with the caregivers that are providing those for them. How do you get the support when majority of people don't really know, right?
Yeah.
It's only by the short amount of engagement that you had with those clinicians and doctor, nurses, and the whole, whatever you can find online, which, now that we have ChatGPT, cloud, and all that things, we can find a lot more information. But do we actually know they're the most accurate? Or even they're accurate can apply to us, right? So having a system that solves these problems for us, we're already thought about it, and we don't have to think about so much ourselves. It gives a lot of weight off the shoulder. So tell us more about the solution that Brook.AI does for it.
Yeah, and that was exactly me and my sister with my dad. Was we would write down the questions that we want to ask the provider, and then we get home and we're like, oh, we didn't ask this, and then we try to call, but you had to go through a total ring around, and it was so what Brook does is comes in and says, not just to the provider, look, there's a much simpler way to take care of your patients from at home, and but we don't want to put more weight on the provider, because as soon as you start managing devices, and tech support around that, and then the billings piece around it. Like there's just a whole bunch of stuff that if you're not careful, you actually put more weight on the clinic or on the system. And so Brooks come in and say, well, let's go through each of those things one by one and figure out how we can do that better and take the weight off a provider. And so we have a care team that operates as an extension of a clinic's or a systems care team that is integrated directly in the EHR, so that all the updates and care protocols and the way that they're treating those patients is populated in the patient chart. So when the provider next goes in, they can see all the updates and the summary notes and things like that. And for the patient, they've just got 24/7 access to care, basically, and that can either be through an app, the Brook app, or if they're not as tech savvy to want to use an app, they can just get on the phone whenever they like.
So is that really a combination of remote monitoring system plus a virtual care team? If you have questions, they ask. How does it work in that perspective?
Yeah, we're calling it sort of remote care as a service. So it's all those things wrapped into one holistic solution.
Every year at healthcare conferences, we meet incredible innovators and listen to what clinicians, health systems, and yes, even patients like us actually need. When you are navigating care for your loved ones, even with all the credentials behind your name, things still feel overwhelming. And that's what I love about our conversation with Luke O'Brien from Brook.AI. His story began as a son watching his father fight leukemia, which eventually led him to join a team solving one of healthcare's biggest gaps. What happens after the doctor visit ends? Brook.AI's remote care as a service model doesn't just monitor patients. It integrates seamlessly into provider workflows and lifts weights off already overextended clinical teams. If you are a founder with an established solution and a user base, I want to present in front of active investors and decision makers from health systems, then apply to be a contestant on healthtechshowdown.com. This is our game show-like event where we actively seeking the right decision makers on your behalf and help you to polish the right messages to speak to the right people so you can truly create the most impactful change in healthcare. Think you should be in the spotlight? Send us a short, under 200 words explanation about your solution by going to healthtechshowdown.com. Tell us why you wanted to be presented in front of investors backing companies in your niche or decision makers already looking for similar solutions that you are building.
So for the patient, they have the device, and depending on the condition, they're taking those readings. If they don't take a reading after a couple of days, they'll get a call from the nurse or a text from the nurse saying, hey, what's going on? And then we've got the care protocols that we design with the system, or we have our own that you can leverage as a clinic or as a provider. And then we have the care team. And then we've got, of course, all the account management around that as well. And, the more operational side that we support with revenue cycle management and tech support and device fulfillment and all the other things that, you don't even really think about, but, that's just more work. So yeah, it's a real wraparound solution.
Yeah, so chronic disease management, principal disease, and compliance of medications and treatment all wrapped into one, especially in a home perspective.
Exactly right.
And then it's easier to get to someone when they need it, and then you can escalate the chain if then become a televisit or actually we need you to come in, so reduce potential hospitalization, ER visits, those stuff.
Exactly right. We do all that, and then we also do a lot of post-discharge, and having a lot of success with CHF in particular on that front with systems. But you summed it up perfectly. That's exactly what we do. We have, in addition to the nurse, the nursing team, we have dietitians, health coaches, and so basically we want to give a patient expert healthcare that's an extension of the provider or the system in the palm of their hand.
Perfect. Yes. And as we start seeing the solution, it's about collaborating all those different components into one system, right, as you say. And one of the challenges as we talk about point solution is that there are a lot of different applications to it. Now, how do we integrate those data points into an existing user platform, right? There are 400 different EHR out there. Yeah. And as you guys are going about it, are you primarily targeting the hospital systems, private community clinics? Where is the sweet spot for you guys right now?
Yeah, it's a combination of those two things. So generally the sort of medium to larger clinics and health systems, from anything small to medium to large, we've worked with all of them. And so those are really our sweet spots. And then in terms of the data side of things, we capture a lot of data. We do a lot of pop health insights on behalf of a provider or a system for the population that we're managing. And we pipe that data back to you as well. But we're not trying to take over the entire data ecosystem, but we make sure that we facilitate and enable the data that we capture back into the health system so that they can get the pop health insights that they need.
Exactly. Is there any sub niches of diseases that you mentioned in CHF? Definitely cardiovascular disease is one of the biggest ones out there. And are there any sub-specialized program that you guys build from it? Or are you pretty much a diagnostic agnostic, right? And you're able to cover majority of anything that goes.
Yeah, so we do CCM, PCM, so we're pretty agnostic for the most part, but I think our core strengths are in hypertension, diabetes, obesity, CHF. And then we're doing some really interesting things with a company called Linus, which is around mental health as well. And so we're extending, how do we take that core infrastructure that we've built and then apply it to GLP-1 management, and there's just so many other aspects that now that we've got that solid foundation, we can just add start to treat other more and more conditions.
Yeah, that's amazing. How are you guys going about getting the right information to the people that really need it, right? Whether it's connecting with health system or really getting to the patient side, because as a providers, my experience was asking patients to get on these remote monitoring platform when they don't feel bad, right? Yeah. When they don't feel sick and they feel like, oh, I know what to do, quote unquote. But do you really, right? Mm-hmm. Like when things actually happened, do they have support? Likely no. Or they think, oh, then I'll just call my doctor. But we know waiting time is still, right? And not that easy to get in. That's why you have urgent care, ER, and that's what we're trying to reduce. So how do you have the right communication right now to get buy-ins both from the patient side as well as these provider health system side to say, hey, have you guys thought about this? Or whatever you guys are using remotely, how can we do it even better?
Yeah, I mean, this is a big part of the relationship that we need to build with upfront with that system or with that clinic to be able to define those care protocols upfront. We've already defined them, but it's about, this is what we do. Do you want any tweaks to that? How do you want to manage that? What are the escalation points? And then it's making sure that it's constant communication between us and the clinic to make sure that we're maintaining that and that patients are getting healthier and that we're constantly iterating on those care protocols as we go. And then on the patient side, a lot of it is about compliancy and patients don't feel that sick, but if they had the education from the provider when they're in the office about, well, these are the statistics about what's going to happen if things get worse, whatever that education might look like, then it's about us coming in and making sure that the nurses are giving them a call if they don't see a reading for, X period of time and making sure that the patients are doing the right things and continually educating the patient about their own condition and the importance of being compliant and doing the things that are going to make them feel better.
When we think about patient care, we often picture what happens inside the clinic. But what about the other 95% of their lives? What I love about Brook.AI's model is that it bridges that gap by combining device, clinical protocols, care teams, and back-end operation into a wraparound support system that patients can access from their home. It's not just about monitoring, it's about preventing the need for urgent care altogether, empowering patients with education and access while giving providers clean, structured insights without extra work. Now, I want to hear from you. As you're watching or listening to this interview, what's one gap in patient care you believe technology can solve better right now? Drop your insight in the comment below or tag a company or your own idea that's tackling in a meaningful way. If you're posting on LinkedIn, make sure to tag me, Sabrina Runbeck. Now let's move on to the rest of the interview. Yeah, so it's definitely a holistic perspective.
Yeah,
for sure. Like when we are looking at a company to say like, how do you grow more effectively, right? And it's you have to take it from what we call that 4-dimensional view, right? Because we know we can plan, strategize all day long, but do we have the right people to actually champion for us to get to the next point? Do we have the actually diligent doers to willing to roll up their sleeves and dive in, right? And do we have the people who are, great at strategize, but once your strategy, you can't rely on them to do the next thing, right? Because that's not their best self. So we're always about like leveraging the best human capital behind it. So how are you guys as a team be able to put the right people and things together as you move forward?
I mean, that's just about great hiring and making sure that we're getting amazing people on that clinical care team, and continually improving it. And Alex Foley is our VP of nursing. She's amazing, and she I think it's one of those things where A players just attract other A players, and she just does an incredible job with that. And then it's about rolling up your sleeves, but also for us it's the nurse is going to be so much more motivated, and the care team is so much more motivated when they have a deep relationship with that clinic and with that system, so that they do feel like they're a part of working as part of that team. It's not just you're over here and you're over here. It's not, we're a team working together on this patient panel to make them improve their quality of life and their health.
Yeah, exactly. It's about taking your time to hire the right people. And then when you have this amazing mission and core value, you stick to that. And you bring on the people who already embody that and not just feel like we can train them to be that way, right?
Yeah, exactly. And it becomes easier the more people buy into that vision, because it's an easy vision to buy into.
Exactly. Now, we always know entrepreneurship in growing any solution has its ups and downs. So we always like to ask a fun question. If we give you a magic wand and you can use the magic wand for any 3 things possible to help you in any aspect of getting Brook to the next level, what would you use it for?
It's such a good question. I think really just being able to get in and speak to the right people at systems, I think is really important, because they're so busy and they just got so much on their plate, and they've got so many solutions being sent their way. But I think whenever we do have a conversation, it resonates, because we can be live in 30 days. There's no upfront cost, and it's profitable from day one. And any time a system hears that, they're just like, oh well, how do we get started, kind of thing. So yeah, that'd be my number one. Was it 3 that you asked for, or 1?
So you can use for 3 different things.
Okay, that's one. Interoperability with EHRs would be another classic story there.
Yeah, there's too many of them to be built from the back end.
Yeah, just making sure that we can give us a really amazing experience, seamless experience, frictionless experience to the patient, and that can get in the way a lot of the time. Or make it more difficult and time consuming, costly to deliver on the promise. And then thirdly, we've got big dreams, and we need some capital to fulfill those dreams. So we're always looking for really great strategic investors as well.
Awesome. What series are you guys opening to now?
We're just closing the B, and so but we'll probably be looking ahead already, I'd imagine.
Yes. It's always good to prepare early, right?
Yeah,
like to
exactly.
be able to, just like you're saying, those data points, and that's what I love to see. So that's amazing. Like, so excited for all the stuff that you guys have going on, or the success that you guys already built. And then as we move forward, can't wait to see the journey ahead. And for us, we're always like to be, as a show, as a listener, so we like to be the connector. We like to be the support system. So for any of you guys who love the idea, make sure to go check out Brook.AI. And how is the best way, if they wanted to find out more information, is I reach out to you or specific area of the company that would be best?
Yeah, I mean, you could there's a contact us on Brook.AI. You can reach out to me directly on LinkedIn, Luke O'Brien at Brook, or Oren Nissim is the CEO, and I'm sure would love to hear from you as well.
Awesome. Yes. We understand healthcare is built not by one person, but it's a collective effort. We can play our smart part, but what I always call it, the empower ecosystem, right? It's like you're saying about hiring, when we have the right people with the right resources, and then we don't feel like we're blowing the ocean, but at the same time, we can all do this together. So excited for all the stuff that you guys are doing, and for anybody else who are championing in the space, especially for helping people and their patients at the home stage. Make sure to go to Brook.AI.
Yeah, thanks so much for bringing awareness to us as well.
Yes.
Yeah, appreciate it.
Despite how powerful and impactful you think your solution can be, but if it adds more steps, more dashboard, and more questions, it might be doing the opposite. My conversation with Luke O'Brien from Brook.AI taught us these 7 key points when building a highly engaged remote care solution. Number 1, personal story sparks purposeful driven innovation. How Luke entered the healthcare system wasn't through formal training. It was personal. After losing his dad to leukemia, he noticed major communication gaps in patient care. That loss catalyzed his journey with Brook.AI, underscoring how real-life problems can shape scalable health tech solutions. Number 2, remote care as a service redefines chronic disease management. Brook.AI integrates 24/7 access to care with virtual care teams, remote monitoring, tech support, and revenue cycle management, creating a holistic infrastructure that doesn't add weight to already overwhelmed clinics. Number 3, EHR integration is key to system adoption. Brook.AI works as an extension of existing system by integrating directly into EHRs. This ensures care updates are invisible to providers, improving both patient outcome and provider workflows. Number 4, building the right team drives real impact. Hiring people who are mission aligned and deeply skilled, like their VP of nursing, enables the company's scale without losing culture or care quality. A players attract A players. Number 5, real-time support increases patient compliance. Many patient delays or avoid care until it's too late. Brook's proactive communication model with call texts from nurses when data is missing prevents ER visits and hospitalization through early intervention. Number 6, data should enable, not overwhelm. Well, Brook.AI captures valuable health data. They don't aim to own the ecosystem. Instead, they streamline actionable insights back into system, supporting smarter decision without complexity. Number 7, growth requires the right capital partner. As Brook closes its Series B and looks ahead, the focus is on securing strategic investors who understand the space and share the mission, not just capital. We would love to hear from you. What's one part of your specific service or technology solution that truly are competitive among all other people serving similar clienteles, and how are you able to combine these expertise into something that's simple for others to adapt? Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.